Hi, everyone. Welcome to another TGN live event where the stethoscope meets the suitcase, and every event is a journey into the heart of travel healthcare. I'm your host, Rachel Altum, the online community manager for the Gypsy Nurse, and together we're about to explore the exhilarating world where healthcare and adventure intersects. So buckle up because this is where the pulse of healthcare meets the rhythm of the road. Today, we are diving even deeper in the world of travel healthcare with our friends from Medical Edge Recruitment. But before we get started, let's take a moment to look at the benefits that the Gypsy Nurse has brought to our community. TGN is a one-stop shop for the travel healthcare worker, from insightful interviews with industry experts like Medical Edge to in-depth discussions on healthcare trends on our platform, on the network group, on Facebook, and all of our social platforms and the website. And this is a valuable resource for both seasoned professionals and those considering a career on the move. You can listen to these sessions and the other ones on thegypsynurse.com on demand. Just go to our events tab. Not only are we the only largest online community, but we also hold the largest in-person travel healthcare conference in Las Vegas every year. Super early bird tickets are now on sale for $379 until the end of the year. Alumni, you also have a great deal too, so be sure to check it out. Don't miss out on the event of the year for travelers. Just go to travcon.org to learn more. We have a lot of fun education and a lot of fun there, so be sure to check it out. So let's now get ready for an engaging discussion that will not only inspire you, but also provide valuable insights into the future of travel healthcare of 2024. So sit back, let's relax, and go on this journey together. Please welcome Medical Edge's Director of Marketing, Rikki Speck, and Inbound Marketing Specialist, Taylor DuPont. Hi, ladies. Thank you so much for joining us. Super excited to have you back on.
Thank you for having us. Yeah, we're excited.
Yeah, so I'm gonna let you take it away. I'm super excited to hear what is going to be happening next year.
Perfect. So I'm Taylor. Like Rachel said, I'm the inbound marketing specialist here at Medical Edge Recruitment, and I'm here with Rikki. Again, like Rachel said, our director of marketing. So today we are just going to go over some information based on what travel nurses can expect in the coming year. So for 2024. So we're just gonna jump right into it. Rikki, I know that you have been in the industry for about 15 years now. So to get started, can you tell us some of the trends and or changes that you've seen over the years in the healthcare field?
Yeah, so I got started in the healthcare industry, obviously, when I was 10, because 15 years. So I've been in the healthcare industry for 15 years. And, what was so crazy is that when I started just like, a little baby healthcare person right out of college, I worked for a company where we went and implemented EHRs. And at the time, like Epic was like the smallest one that my company I worked for implemented. Like nobody wanted to be on the Epic team. Nobody knew what Epic was. This is how long ago it was, folks. It was so long ago. I was on the Meditech team, which like I don't think really very many people have Meditech. And I was like on the, what? You're on Meditech? That's crazy. So cool. But we would go out to hospitals to implement their whole EHR. And we would live in these like travel houses. And I was sharing my corporate housing with this woman. Her name was Glenda. So obsessed with her, but she had been a nurse for like 30 or 40 years. And I remember being like in meetings, but ADHD girl here, I'm going to tell you a side story about Glenda. So we would sit in these meetings with Glenda, and like at 10 o'clock in the morning, Glenda would like lean over to me and she'd be like, I cannot wait to take my bra off. Like to the point I was like, Glenda, we really need to talk about your bra situation, girl. Like that this is that this is your problem for you. But she just knew so much about the healthcare industry. She'd been a nurse forever. She'd been doing consulting forever. And I remember this was like in the early 2000s, and she was like, there is a crisis coming in nursing. She was like, so many of us are like, old gals ready to take our bras off, like Miss Linda, that they were about to retire. And she was telling me how hard it was to get into nursing school, and that there were not enough nurses that were coming in, and that there was a huge nursing shortage coming up. And so, Glenda, wherever you are, hopefully you are not wearing your bra, because I knew that's what you wanted then, girl. But you were right. We are in a huge nursing shortage, and so it is a little interesting to me when I start to hear folks talking about the nursing industry and it being something that was precipitated by COVID, when people like that had a ton of experience that have been around. I mean, they've been talking about this coming up like in the late 90s, early 2000s. So yeah, now here we are, just like Miss Glenda anticipated.
Yeah, what a prediction she had there. So now we'll kind of just get into more of what we can expect for the upcoming year. Again, obviously a lot of it will be centered on what you were just speaking on. So the first question I have for you is, what do you anticipate will be the most significant differences in the travel nursing industry in the next year compared to the current landscape?
Yeah, I mean, so I think everybody is experiencing the same thing, that during COVID, it was all about quantity, like how many bodies could we possibly get in from an agency standpoint. And like the quality and the speed weren't as important. I should say speed was probably important, but it really was about like quantity and how fast you can get them in there. What we're seeing now is that people are a lot more focused on the quality, and of course, speed is still important. So, for us as an agency, one of the things that we are encouraging anybody that is trying to come on board with us or that's trying to get placed, number one, like the best way that you can make yourself look on your resume, like you want to get your resume together. You want to ensure that you're really putting that best foot forward, because, hospitals are being a little bit more particular about who they were taking. So maybe in the past, it was easy for you to get into, a facility. Now they really truly are looking a lot for that quality. The other thing is, of course, the speed, how fast we can get people in. So, when you are working with the agency and they are asking you for all of your credentials up front, they're trying to really kind of rush you through that process and get all of that in place. It's because we have to have that in order to even make that placement. So, the more that as you're looking for, your next placement, for you to be getting all of your paperwork in on time, how fast you can get there. And then of course that quality is really important. We of course are seeing a downslide in the number of jobs that are available, but I think that we really are still in an adjustment period from COVID. It still is a lot higher than it was pre-COVID. So while we are seeing a decrease in those numbers, it's not like it has gone back to pre-COVID time, so to speak.
Yeah, absolutely. So that being said, what role will telemedicine and remote healthcare play in the travel nursing assignments in the near future?
Yeah, that's a great question. So, and it's something that we get asked a lot for people that are looking for those remote type of roles. That's something that for nurses that are really wanting to get outside the bedside, that is a great career opportunity and move. And it really is going to allow you to be able to do more type case management type of work, working with the lower acuity care, type of patients. But we definitely are seeing an uptick in that, and companies that are looking for nurses to be in those roles. And honestly, it's a great kind of career move if you are looking to get outside of the bedside.
Absolutely. So I know you mentioned a couple of questions that we discussed ago, that there was going to be an increase in the number, or I guess the demand of nurses. So how will travel nurse contracts, including compensation and benefits, evolve to meet the changing needs of healthcare facilities and healthcare professionals?
Yeah. So, one thing that, a lot of people that are in current placements right now, especially if your placement is getting extended, over and over, kudos to you. Because number one, that means that you're doing a fantastic job, that, that facility wants you back. But what a lot of travelers might not be aware of is that the facility, every time that you're renewing that, a lot of times they aren't also upping the pay for that. And as agencies, most agencies, especially us, but there's tons of other really quality agencies out there that do the same thing. We are appreciative of you extending that contract, and so we're still paying you that, even though what we're getting paid from the facility is less. So we're kind of eating that cost, and really kind of operating on smaller margins. But that kind of it is what it is from that standpoint. We are seeing that, a lot of the pay that people were getting during COVID, obviously that pay rate isn't available now. And so we're having a little bit of an adjustment there. Hospitals are really being pushed to cut down on some of their costs and reduce margins. But what I really anticipate kind of happening in 2024 is that there's going to be a bounce back around that. Hospitals or facilities are going to see if they can't get nurses to work for that rate, they're going to have to come up. But at the same side on the nursing side is that, if you have a dollar amount that you're like, I was getting this 2 years ago, that dollar amount probably doesn't exist anymore. Right. So there has to be a little bit of like where folks are meeting each other in the middle.
Absolutely. So do you anticipate any lasting effects of the COVID-19 pandemic on travel nursing? And if so, how will they influence the industry in the upcoming year?
Yeah, I mean, so I think that the industry is just going to continue growing, post COVID. Hospitals really are right now trying to mitigate how much external costs that they are looking for. So, local contracts are a lot more popular right now than travel nursing. They're looking for ways that they can reduce some of that cost from that perspective. But I really think that a big thing is that, we talk a lot about from the numbers perspective. You hear administrators talk a lot about from the numbers perspective, but at the heart, I watch a lot of like nursing TikToks. I've got tons of friends that are nurses. Obviously, we interact a lot with nurses here. Is that there isn't enough conversation right now about like the burnout and the continuing effects of trauma that we've got a lot of healthcare professionals that are still working through that they experienced, during COVID, and being really mindful about that. Here at Medical Edge, one of the things that we, have is we have a program or we have benefits that allow for, our providers to be able to, get some, employee help from like that standpoint and to talk to a professional. So take advantage of that. Most agencies are going to have things like that. But the other thing too, when I'm seeing on, my TikTok thing, I was watching last night, one of the travel nurses is real popular and she was like saying, oh, everybody talks about going back to pre-COVID pay, pre-COVID this, but ratios aren't adjusting. So a lot of our nurses are still being asked to do more with less. And, your agency wants to be a partner for you. So if you're being put in a position that, you feel is unsafe, like bring that to your agency. We have, a clinical care team that is specifically works with our, clinicians that when they do have concerns like that, they have somebody that they can escalate that concern with. We will talk to, your facility and really be an advocate for you. But a lot of agencies really have that same type of service. So ask for that, take advantage of that. We all want to advocate for you and make sure that you're in a safe position, your patients are safe, that sort of thing.
Good deal. Now, kind of shifting gears slightly, my next question for you is, are there any emerging technologies or innovations that are likely to impact the practice of travel nursing in the coming year?
Oh my gosh. Okay. I love this topic so much. I'm slightly obsessed with it. So one huge IT innovation or technology piece, especially in the recruiting space and traveler space, is using AI to find the best matches. So we're doing an implementation now where our technology piece is going to be able to do some automated matching for clinicians. So what we would be looking for providers is like, hey, we want to know all the cool things that you're interested in. What are your skill set? What rates are you looking for? What areas are you looking for? We want to know that. And then what we'll be able to do is take all of that information and really be able to apply that. So as jobs pop into our database, you could get a text like real time that's like, hey, this job just opened that really fits into the thing that you're interested in. Do you want to be like first in line to submit your stuff? Let's go ahead and get you like pre-qualified, so to speak. Let's get all your credentials, loaded into your bio. So then that way we can go ahead and like get you submitted real quick. And so when you're working with any agency for our travel nurses, when they're starting to ask you like a lot of questions or they're sending you like those automated texts about, your skill set or what types of jobs, like answer those. where when you can, because that makes your profile better. It's kind of like, Netflix, when you first like sign on and you give like the thumbs up, thumbs down, like the more that you're giving us that feedback, the better your feed gets.
Right.
So take advantage of that. Let your agencies know, give them more information about what you're interested in, because they probably are trying to like give you a better Netflix kind of feed only with jobs.
Yeah, no, definitely better tailoring so that it's better for everyone, honestly.
Yeah.
It saves everyone time. So in terms of changes from like a federal or state or legislative standpoint, what regulatory changes or legislative developments do you expect to have an impact on travel nursing in the upcoming year?
Yeah, so one thing that we definitely are seeing from a regulatory standpoint is a lot of states are starting to push, having appropriate ratios for nurses to patients. I love that. That is something that should have been in place a long time. That's really keeping everybody safe on both aspects. The downside of that, or I guess the positive piece from a travel nursing standpoint, is that we still haven't addressed the root cause of the fact that we're in a crisis from a nursing shortage standpoint. So it's great for those ratios to be in place. They should be in place. That's like table stakes. But there aren't also like all the nurses available to like fill those ratios. But I think from a travel nursing perspective, what is going to happen is that really is going to open up a lot of opportunities for travel nurses. So, as states are passing those are great locations for you to really kind of keep your eye out on, because there's probably going to be a lot of travel opportunities that are going to open up in those areas. And we're seeing a lot of that. I know that there's a lot of talk recently about, having always needing an RN at long-term care facilities. And that's some legislation that is up to be passed soon. And if it is, and you are in that long-term care, field in an RN, that's going to open up a lot of opportunities, for you. I do think it's going to put a lot of pressure, especially on our rural market, and whether or not they're able to, get the bodies that they need, or the nurses that they need in order to, fill those state mandated.
Yeah, it'll be interesting to see how that kind of plays out and affects different things, like you said, especially in particular areas.
Yeah.
So, of course, we've mentioned quite a few expected changes for 2024. So, how should travel nurses prepare for and adapt to these anticipated changes that the industry is going to see?
Yeah, I think there's going to be a lot of continued pressure around the ratio piece. And sometimes it takes states longer than it should to pass things, or for facilities to implement pieces. So keep yourself knowledgeable, advocate. The more that, the nursing community can come together and really act as a collective or a whole, you guys have been doing that over the past year, and we're seeing real change happen from a legislation perspective. So keep doing that, keep advocating for yourself. But also, educate along the way. So, for fatigue, for burnout, don't be afraid to speak up about that. I think for a long time, people didn't want to talk about trauma at work, and they didn't want to talk about, some of that stuff. But, there's such a direct link to the type of care and the quality of care that nursing or anybody in the healthcare field is able to provide to patients. There's such a direct link to that quality of care. So continue to be vulnerable and open and talking about that. It's so important. So then that way, everybody can continue to advocate.
Perfect. So we've, of course, been answering a lot of questions from the nurse perspective, but the facility as well as the agencies, of course, the way that they operate and the things that they do directly affect the nurses as well. So how will travel nursing agencies and healthcare facilities need to adjust their strategies to align with the changing landscape in the coming year?
Yeah. So, I think a couple of things that I think of right off the bat is that from an agency perspective, how most old school agencies have worked, right, is doing a lot of like calling and doing a lot of that piece, which is great. We don't want to lose that person-to-person connection. But especially as we have more younger nurses that are like coming up, or more tech savvy where they're like using apps, they're using social media. That is how so many people are used to, used to working and used to, kind of engaging, so to speak. So we're going to see a lot more apps that agencies are using. I think, a lot of the larger agencies, like they've had those in place. But you're going to see a lot more of like automation around those apps, a lot more of AI that's being utilized to match you to your perfect role. Honestly, as just a regular job seeker person that's looked for jobs, might not have been nursing jobs, but I knew how annoying it was when I would get jobs that like, why are you reaching out to me about this? Why are you sending me the CFO stuff? Like, I was a marketing girl. Like, why are you doing that? And so I would get so annoyed by that, and so for a lot of, nurses, like I know that you guys get annoyed when you start to get jobs that you're like, ER nurse is not what my thing is.
Right.
So, us really like utilizing that, utilizing social media more to like do recruiting. When we see that we've got travel nurses that are out there like using TikTok and things like that, you probably are getting some folks like hitting you up for like, based off of the brand that you built for yourself. So
right.
I think we're going to start seeing a lot more of that.
Okay. Now, kind of shifting back toward, I guess more focused on the nursing perspective and whatnot. Are there any skills or qualifications that will be particularly valuable for travel nurses in the near future?
Yeah, so we talked a little bit in the beginning about how facilities are looking a lot more for that quality piece. If they are having to pay a premium, like they want like the best of the best. So when we start looking at the necessary skills that are like the softer skills, right? Adaptability and flexibility. They are paying you more than they're paying their direct hire or permanent. So they probably are going to expect you to flex a little bit more, and being comfortable with that. If this is your first travel assignment and maybe you feel like walking into that facility, like it is like a little bit like chaotic, or they're asking you to like flex between shifts, like embrace that, because that is something that they're specifically looking for.
Right.
You'll also, having like critical thinking skills, somebody that doesn't need them necessarily to hold like their hand all the way through the process, and really being able to communicate across the floor, with the agency, with supervisors, over communicate like every way that you can, because there might be some aspects where they're like assuming that XYZ, like you guys talk up and you got to communicate and say that you don't know. And then I think that for minimum qualifications, again, because they are looking for quality, before you could have less experience.
Mm-hmm.
And now what we're seeing is that a lot of facilities are asking for like an increase of experience, where before maybe you could get away with just having like a year nursing experience.
Mm-hmm.
Now they're like multiple years experience. Like if they're paying you like, high premium rates, are really expecting you to come to the table with a lot more experience. And then of course, like having your state, compact state license, those kind of table stake type things.
Okay. So what advice do you have for healthcare professionals who are considering a career in travel nursing in the next year, given the projected industry changes?
Yeah, so we see a lot of first-time travel nurses that kind of make the mistake of seeing like a high dollar, pay or high pay rate. And like, oh my gosh, that's so amazing. Like they are so excited to jump on board. You used to be a recruiter, so like I'm sure, you've seen that. But you really have to keep in mind, like, well, what are your expenses that you already have? And what are the expenses at the location that you're going to? Most agencies have kind of like a calculator that they can give you to like utilize to kind of think through that. But you have to be thinking about, all right, well, if I need to leave my car at home for my partner, how am I going to travel to and from my work site? Like, do I need to take Ubers? Like, what does the housing situation look like if it's a hotel versus Airbnb? A lot of Airbnbs might require you to like pay a deposit, or what is your agency kind of helping you from that perspective with? But you need to like really sit down, and I'm an optimist at heart, so I'm not good at this. So find you a friend that is, if you are like me, but really think through what is like all like the worst case scenarios, what are all the possible expenses I could have, and is this high dollar amount really going to cover that? Because just because you see that rate doesn't mean that that's the best.
Right.
There could be a smaller dollar rate in a rural town that has like way cheaper cost of living. At the end of the day, you're going to pocket more.
Right. Absolutely. Yeah. I used to see that a lot when I was on the recruitment side of things. And it was almost like a shock factor sometimes to people when once they would get offered a contract and then they would kind of dive into figuring out what it was going to actually cost them to live there. And they wanted the contract initially because, like you said, they would see a high like sticker price in a sense on it, right? Like they're getting a good pay rate, but it really didn't, the high pay rate didn't really outweigh the, really high cost of living in whatever area it may have been. So definitely something to pay attention to for sure.
Yeah. Oh, one more thing too, that I would also keep in mind, this is your first time being a travel nurse, is that the IRS does tend to keep a little bit of a higher eye or, focus on people that are doing things like a travel industry, travel nursing. So if you aren't really comfortable or knowledgeable about like what some of those like tax regulations are, there are tons of, tax accountants out there that would love to work with you. The cost is very minimal and it will save you a ton in the long run. So we really recommend that you for sure, like get yourself a tax accountant that can give you some good, guidance around that so that you aren't making some, rookie mistakes there that at the end of the year, you're like, I have to pay what in taxes?
Right.
So yeah.
Definitely. Now, I think this is probably the last question that I have for you, but can you discuss the impact of the labor market, such as shortages and surpluses, on travel nursing assignments in the coming year? And I know you've touched on this a little bit, but if you could give us maybe like some more specifics on things.
Yeah. So, I think we are going to continue to see a shortage in permanent hire positions. A lot of nurses or a lot of providers are a lot more hesitant to like hook their wagon onto a facility or a health system. And they really like the freedom of being able to go where they want to go, have contract links, the length of time. Maybe they've got burned by a facility in the past and they're like, I'm not trying to like commitment. I have some commitment phobe issues, and so I think we're going to continue to see that permanent hire positions there's going to be a shortage like in people that are willing to do that. So because of that, a long run, there's going to be a lot more opportunity for travel nursing, and that where facilities or healthcare systems might have a beginning to look for those permanent hire positions. They're going to find I can't fill them. I now have to go to travel nursing or local, contract type things. The specialties that we really kind of see the most in demand right now, and I don't see this changing, is really going to be like ICU, med surge, ER, long-term care. Obviously, with some of the new things are going to be passed through, through Congress, the long-term care is going to be a huge one. Psych, corrections, those are all areas that we see huge opportunities in and growth for people looking specifically for those travel nurses. And then the states that, are looking the most, obviously are going to be like Florida, Massachusetts, Hawaii, Texas, Georgia, Pennsylvania, California. Those are all going to be states that we continue to see a lot of jobs that are available for travel nursing or local hire positions, but that are contract.
Awesome. Yeah, I feel like that was a really good like snippet of information on the specifics and whatnot. But thank you so much for taking the time to do this.
Yeah.
This is fun. I think we can bring Rachel back on.
Perfect.
That was so great. I loved hearing all about that. I'm so excited for this next year, and hopefully some good changes come out of, with legislation and all that kind of stuff. So thank you guys so much.
Thank you.
Yeah, thank you. And we love having you guys on. We can't wait to see what you bring us next year. So I know it was your guys' first time doing this. Medical Edge does it every quarter, but you guys were first timers, and I think you guys did great. The audience loved you guys. So thank you again for joining us. We can't wait to have you on again.
Thank you. Bye.